New this morning, a health alert from the CDC about the rising number of measles cases around the country and overseas. Health officials urging vaccinations to help prevent more outbreaks. ABC's Reena Roy has more on what you need to know.
Measles is on the rise around the globe. The CDC warning of an increase in cases and outbreaks here in the U.S. and abroad. So far this year, there have been 58 confirmed cases across 17 states. That's equal to the total number of cases we saw in all of last year. Jessica Coletti says her 3-year-old son was recently infected.
He woke up Monday morning, didn't talk, didn't move, and the rash started on his cheeks, on his face, and moved all the way down his body. I honestly thought he was going to die in my arms. And I just kept telling him that mommy's getting help and you're going to be okay.
Her son is doing better now, but she doesn't know how he got it. She says he got his first dose of the vaccine, but isn't old enough for the second. Measles is highly contagious. One infected person can infect 9 out of 10 unvaccinated people. Officials say 93% of the cases this year have been linked to international travel, mostly in kids over 1 year old who did not have the MMR vaccine. Countries like Austria, the Philippines, Romania, and the UK are all seeing outbreaks. The CDC urging any child over 6 months old who is traveling overseas to get vaccinated before leaving, and those who are not traveling should still follow the standard CDC vaccine schedule, with children getting their first dose at about 1 year old and their second dose between 4 and 6 years old.
When kids have one vaccine in, we're talking about a 93% efficacy in protection against the measles. When they have 2 vaccines themselves, we go up to 95 to 97% efficacy.
Now, the risk of this spreading widely is low across the U.S., given overall high population immunity. However, some pockets that have lower vaccination rates are at higher risk for outbreaks. Reena Roy, ABC News, New York.